Welcome back and thank you again kwa sababu haujatoka na haujatingiza mitambo. I want to remind you again, this is a gift. I am your connection. Yani you want that house, you want that space. Usiachilie ofisi ikae just anyhowly, because we have DreamWorks Investment Limited Company here for you, and all you need is to make a call and you will get every detail you need. Now, back to the question.
Yes.
Please, can you elaborate to us?
Yes.
As we had asked.
Yes. Now, even before I get to that, it is good that I mentioned to the audience that stool tests are routine tests.
Okay.
When you come in as a patient, please do not worry. We examine quite a number, so don't worry whether it is to do with the smell, whether to do with, no. The moment it leaves your stomach and intestines, please release it with a good heart. It is now ours.
Oh, okay.
And we'll do our best
to
ensure that you're back to health.
Now, back to the question.
Yes.
Most of the people, ikifika ni maybe ulcers, ama H. pylori, tunaonanga maybe it's a test that's done maybe kwa mdomo ama vomit ama nini. Can you tell us kwa stool, what is checked and when?
Okay. Now, H. pylori is a big challenge.
Okay.
Let me say in the African countries. And Helicobacter pylori is actually a bacteria. And we acquire this bacteria mainly on the oral route. That means there's some contamination. And either in food or in water, you end up taking something containing that bacteria, and it ends up inhabiting, let me say, your stomach. Like majority of other bacteria. Let me say any other bacteria that is to do with the gastrointestinal tract. Now, this bacteria may just sit and, let me say, in the stomach, may not even harm you. And quite a number of people will usually have this bacteria. Now, if I take you back to what we call digestion, digestion of proteins happens in the stomach.
Yeah, true.
And this digestion is done using an acid. And this acid is called dilute hydrochloric acid. So any food items that are within the category that we call proteins will usually be digested using that acid. Now, the stomach is also a protein. Ni nyama, just like any other meat. So the question is, why isn't the stomach digested? Yet it is a protein like any other. Now, the answer is that the stomach is lined with mucus. It has a mucus lining, and once the acid is poured into the stomach, that acid does not get into direct contact with the stomach wall. Now, this bacteria now comes in and interferes with the integrity of the mucus lining, allowing that acid to actually penetrate, and it tries to digest the stomach wall. And the moment it tries to digest, of course, the body will try to recover. But at the end of it all, you will usually have what you call a digestion will happen on the stomach wall, and you end up with a wound, or what you call an ulcer. Now, you may have this bacteria, but you may not have ulcers. But eventually, depending on the degree of damage to the stomach wall, eventually you will have the ulcers. Now, once these ulcers get established, anytime this acid or stomach acid is poured into the stomach, we'll usually have irritation of those ulcers. Now, not only that, but any foods that are high in acidic content will also cause irritation to these ulcers. So you may hear people talking of, anytime I take some foods like sukuma wiki, anytime I take beans, I end up with a burning sensation within the stomach. Now, the severity may be different, but eventually we a person who has H. pylori may progress to formation of ulcers and hence the signs and symptoms of the disease.
The disease.
Correct. So we usually have a kit that we usually use to detect the H. pylori, and we may also either do it in stool or in blood. Okay. Although we also have others, what we call histological testing, where small, let me say, chunks or tissues will usually be picked and examined microscopically for formation of ulcers. Okay. Now, once somebody has these ulcers and they'll present themselves, we will do the test. Usually takes about 20 to 30 minutes. Okay. And once we detect pylori, then one will usually be managed for, let me say, Helicobacter pylori infection, or what we call ulcers, and they usually put on a kit and dietary advice. They are foods that are high in acidic content that they are supposed to avoid.
Oh, okay.
Correct. Now, the symptoms may vary.
Oh, okay.
And when it comes to H. pylori, we will usually have them being long running. In other words, you will not say that yesterday I was okay, but today I'm feeling unwell. Depending on the degree of damage to that mucus lining, they tend to come gradually but worsening over time. Okay. So somebody may actually come and say, I'm experiencing either a feeling of fullness or discomfort, a burning sensation, a general feeling of being unwell. Others may even go till, let me say, vomiting. So the symptoms tend to vary. Okay? But the general observation is that they may take a while to show up, but it gets progressively worse over time. Yes. So when it comes to the management, they will usually be put on the kits, and depending on severity of the infection might actually require more than one treatment.
More than one treatment.
Yes. So some people will present themselves when the disease or the infection has progressed significantly. So might require more than one treatment regime.
More than one treatment. So yes. When is it needed that I will be sent to a lab for a test? When is it, when isha grow ama bado ikiwa the first stages?
People are different. And it will usually depend on, let me say, the progression will usually depend, number one, on the load of the bacteria, the person's immunity. There are those who will actually stay with that bacteria in their bodies and without any symptoms. And they will move on for years and years and years.
And it won't affect
them.
And
it will not affect them. Whereas there are those who will usually show those symptoms sooner. Okay, so once the clinician suspects that you're dealing with pylori, they will usually send them for a lab test. And the best approach is first deal with the basics. Does this person have amoebiasis? If they do not have amoeba, then let's do a pylori test and we see whether what is affecting them is out of infection with the Helicobacter pylori bacteria. Yes. Now, if you may also allow me, when somebody comes to the lab and says, I have an issue of acid, there are two different things that we are dealing with. One is infection with the H. pylori bacteria, which causes ulcers. And the other one is what we call acid reflux, where for one reason or another, acid may actually move up the, let me say, trachea, causing either heartburn or irritating the trachea. And others may even experience, a bitter fluid in their mouths. So those are usually two different things. Okay. And the second one, which is what we call acid reflux, may also result in pain within this area, what we call heartburn, and may be worse at night. And the control tends to be different when we are discussing on acid reflux. Yes.
Now that we are talking of acids,
yeah.
Now before the test,
yes,
and everything,
yes,
how do you calm it down? Unajua kuna watu wana believe
yes,
sugar, chocolate, or something. How do you reduce the burning sensation before you get the results, or before you get treated?
Now, depending on what you're talking about, Helicobacter pylori will usually be kids. However, when it comes to acid reflux, we will usually talk of control mechanisms. Now, the first one is on diet, where spicy foods may make it worse, oily foods may make it worse, and then we usually advocate that those who are affected take their meals at least 3 hours before bedtime, so that we will have the digestion process already having gone through, or let me say it will have progressed significantly. So they also advised to prop up their heads using a pillow when sleeping, and then to sleep on this side where the stomach is, more or less to reduce the flow by gravity outwards. Now, once the symptoms are severe, or when there's discomfort out of those symptoms, they may be managed using antacids to neutralize the effect of the digestive acid flowing outwards.
So if a doctor sends me out maybe to get a lab test, how can they find you?
Now, we are located at Aremi Clinical Laboratories, which is off Mamangina Street on ACK Centenary Plaza, which is directly opposite the Urban School Gate.
Okay.
That is where Nema Chemist is. Just proceed ahead. And we are on ground floor at Aremi Clinical Laboratories.
Wow.
Yes.
That is an amazing session now that I have come to learn of it.
Yes.
And I have learned that stool is very important when it comes to the lab testing, because it tells everything that happens, the end product, your entire body.
Exactly.
So it can tell a lot.
It can give us a lot of information of what is happening in your body.
What is happening in your body.
Yes.
So when you go to a lab, don't be afraid, usiogope wenye utapata uko. Just be free and ensure you put your health first. As we say hapa Health Hub Show, your health comes first, because if you're not healthy, how will you live and how will you enjoy life? Now, thank you for keeping up and thank you for following up. This is Oboro TV Business and I'm your health host, Nyambura Kamau. And again, I will remind you, don't waste your resources, don't waste your funds, because DreamWorks Investment Limited, they are here for you and they are the people you need. Wapatie to your finances, trust them, and they will give you the best when it comes to architectural design, when it comes to project planning and managing it, and the best of it all, interior designing. So don't mess up. We are here for you. Just get their contact below and reach out. See you next time.